This is an epidemic that concerns all of us. This is not something that only the Department of Health is responsible in containing. It is important to understand that we all have an individual task and responsibility. That means that all South Africans need to take it upon themselves to ensure that they are protecting themselves, that they are staying at home when they're sick if possible, that they are practicing personal hygiene at the highest order. It's also important to speak to corporate South Africa to say that it's very important that they too come to the table. Ultimately, a weakened workforce is one that will threaten our economy. It's important that as a private sector that we come on board to make sure that the workplaces, are protected and that when people are sick, they are given the time off so that they can self-quarantine. They are teaching people on hygiene and how to take care of themselves, but how are people expected to do that when we clearly have a shortage of water in hospitals in villages? So that is where also the Minister of Health and Minister of Water and Sanitation must begin. And like I said, primary healthcare workforces must be trained so that they're able to detect the symptoms and they're able to deal with them. So this is where we are standing as the EFF. And we call on the transparency from the Department of Health on the matters and the cases of coronavirus. So people must know what is happening in the country.
Defying authorities has in some way been treated as synonymous with being brave. That era is gone. We should not repeat that. Let us follow what the authorities are saying in the interest of human life. When they say, please do not panic, let us not panic. When they say, please do not buy unnecessary goods thinking that those will help you, please don't do it. When they say wash your hands, don't do the following in terms of what is required for care. Please don't do that. In that way, we will work together. If they come to us and say we are now thinking of putting in place travel precautions and ban, let us follow them. When they come back to us and say it is now time to suspend mass activities, let us follow them. Life is important. We will go through this situation and we will learn how best we have gone through it and what we need to do in future in order to prevent it.
What we have here is a situation where the safety of workers is really at stake, especially healthcare workers. We hope that the department can strengthen its mechanisms and systems that are already in place, especially to protect those people who are doing frontline work. You have a situation where you have got community healthcare workers. These are the people who are meant to visit the elderly and the sick in their homes. Unfortunately, they are not part of the public service, and that is something that has to be addressed. Because if they're not part of the public service, it means that they don't have access to what health workers in the public service have. So we hope that the department can put measures in place to protect those people, because they have a critical role to play if we were to contain a virus of this nature, especially because many fatalities happen to be the elderly. So those people are going to be our frontline soldiers.